Hello everyone, I am Dr. Jashan-Your and today I will be answering some questions regarding painless delivery or epidural analgesia as we call it. So let's begin. So what is painless delivery? Can a labor be really painless? Well, yes, because today's modern day techniques, they offer us a variety of methods with which we can relieve the pains that are experienced by a woman in the labor to an extent which makes this entire process a better one and not a scary one. So one of the best methods that we have is epidural analgesia. So let me walk you through the procedure. With the help of an anesthesiologist, we take an injection and put it in your lower back, through which we pass a epidural catheter, and through this we give controlled doses of the anesthetic drugs which will help to numb down the nerves which carry the pain sensation in the labor. And so when the area below your stomach, it gets numb, you don't feel the contractions that much. Means you are having uterine contractions, but you're not going to feel the pain as much as you should. Back mein injection lag raha hai. So many patients, they ask me that, ma'am, is it the same thing as that in the cesarean? So no, in cesarean we give spinal anesthesia, in which the drug is directly going into the spinal space, and in the epidural analgesia the drug is going into the epidural space, and the dosage of the drug is also different. But there's an added advantage that if you have taken epidural analgesia and for any reason if we have to do a cesarean section, we can do it through the same catheter. We can give a more dose of the drug, and you don't have to undergo another prick for this. Yes, epidural analgesia is very safe, and if handled by a team of expert gynecologists and an anesthesiologist, there is no serious threat to the life of the mother or the baby, and there is no associated complication as such also. If done properly, we can achieve up to 80 to 90% of pain relief, which is a lot when you consider the pain that is what they say is 20 bones breaking together. Yes, if you are someone who wishes to have a vaginal birth but has a low pain threshold, you can definitely opt for epidural analgesia, but always discuss first with your doctor if you're the right candidate for it. No, there's no 100% guarantee that you will have a normal vaginal delivery if you have an epidural. But the chances of cesarean due to maternal distress, that is mother not being able to take the labor pains, they are highly decreased because the pain relief is so good that she is able to handle these well, she is able to take it. There are many benefits of epidural analgesia, and one of the biggest one is the pain relief, of course. And like I said that it decreases the chances of unnecessary cesarean section, and the mother, she is awake during this entire procedure, so she is actively participating in the labor process with us. There is no long-term side effects as such also. In some cases there can be an allergic reaction to the drug and it can cause itching, or there could be a little headache or tingling and numbness in the lower limbs. It is not something that cannot be managed, and it's not very common also. Well, and due to pain relief, the efforts of the mother to push down the baby, they are decreased, and so this leads to an increased chance of using instruments for delivery like forceps or vacuum. And sometimes when we give the drug, there is suddenly a drop in the blood pressure, and the baby's heartbeat also falls down with this, and for that your attending doctor will suggest you an emergency cesarean section and you might have to get it done. So these are the only things that we have to take care, but with proper monitoring and with the proper help of gynecologist and expert staff, we can achieve a good result with this. Both are okay in their own way. There was a time when even surgeries were being done without anesthesia or pain medication, but now with so much of advancement and so many techniques, I think it is every woman's right to know about this, to have an informed choice about this, because she knows about her body the best. So always make an informed choice, Wishing you a happy and safe delivery.